Hey guys, it's Dr. Emer. You know, I'm a cosmetic dermatologist in West Hollywood, Beverly Hills, California. And I'm excited today to be here at our virtual conference talking about BBL. Just so you guys know, Sciton is one of the greatest companies I've ever worked with because I work with companies that have amazing technologies and a lot of science behind their advancements. And the Joule X device that I've been using for many years now with BBL, Halo, ProFractional Contour, SkinTyte, etc., are probably the most used products in my practice and give such dramatic outcomes with very low risk. And the thing you guys want to know is that when you're adding a device to your practice, you want to ensure that it's safe, it's very effective, and it has a lot of science behind it. And so what I wanted to talk today was about a body treatment that's going to be hot for 2020. And you know how we've been going with 2020. So it's nice to have a couple positive things to look forward to, specifically Forever Body, powered by the BBL Hero, which we'll talk about. Hero stands for high energy, rapid output, basically really quick pulsing to be able to get virtually painless improvement with the BBL technology. So BBL Halo, you guys, is going to change everything you do in your practice. A few things are, if you don't have BBL, you need to get it. Because I always tell people IPL is old school. BBL is like the iPhone 11 and IPL is like the iPhone 4. BBL is going to give you much better tightening, improvement in complexion much more quickly. You're not going to have, and we'll talk about this, the stamping anymore because the frequency is going to be much faster. You can do these treatments much more quickly. And overall, BBL has the Forever Clear, Young, Body, Bare, and SkinTyte. What is that? Clear for acne. Forever Young is probably my biggest treatment I do in my practice. I don't do as much acne because my patients are typically a little bit older, but Forever Young, which does vascularity or redness, pigmentation, and wrinkle discoloration and sun damage, is a multitude of wavelengths used together to give tightening, to give complexion improvement with literally minimal downtime. Now with Forever Body, which we call it motion, and the Hero technology, this high energy rapid output, you literally can treat wide areas like a chest, an arm, a leg in minutes. It's unbelievable. I have done actually my arm, you guys could see, it's so clear. I've done my arms a bunch of times already when we were first testing. We do chest consistently. You know, I'm known for combination therapies, and in general, you can't have one company's technology, although if you needed to have one, the Joule device or the Joule X, which has pretty much everything, all of these things, SkinTyte for tightening, Forever Bare for hair reduction, and then also Forever Young and Clear for vascularity, acne, and pigment, you can pretty much get almost anything. With the M-Joule, which is the BBL Hero plus Moxie, which is a 1927 non-ablative laser, you have such diversity. So in general, the Sciton technologies can almost give you anything. The problem is I just cannot be 100% committal. I like to try everything. So in my practice, I'm often combining microneedling radiofrequency with my Forever Young and my Forever Body, because I'm doing that on the chest and the arms at the same time. I'm then doing my Halo and my ProFractional from my Joule device on the face, maybe SkinTyte for tightening. We're doing it all. But what I'm talking to you about today is the high energy rapid output. And that's the thing I was saying here is you can literally quickly treat large areas with Forever Body. It's pretty astounding. I mean, I've never seen anything like it. If you look at these photos, not only pigment improvement, but tightening of the skin and wrinkles. Forever Young, literally my go-to treatment for pigmentation, redness. I combine this pretty much with every treatment combined with a microneedling radiofrequency for more tightening and a non-ablative laser for improvement in texture and scarring. And that could be whatever device you have in your practice. One of my go-tos being Halo. But again, you could have Moxie now with the 1927 wavelength on the M-Joule. And then if you have acne, I mean, in general, though, just so you guys know, any light device, any non-ablative device is going to improve acne. But the great thing about BBL body is you can treat large areas fast rather than stamping, and there's hair removal and skin tightening. So how is this different? You know, this is much more of an advanced technology. The handpiece size is very ergonomic to your hand, but also the window is much larger. There's the pulse width has much more control, and it's much more cooling. They say specifically for the Hero, there's 4 times more speed because you can do rapid hertz, 3 times more peak power because remember, you're doing quick pulses fast, and double the cooling, which limits the risk of all that striping and stamping, which a lot of people have gotten from IPL. Actually, in our marketplace, hair removal and IPL are the 2 most common things that people get sued for because the risk of burn. With this technology, that risk is so limited. I mean, actually, I haven't seen it yet, and you know how crazy I am, you guys. I'm like they call me the cowboy of facial rejuvenation. So we're getting that speed, we're getting that peak power, we're getting that cooling using the Hero device. I mean, my staff knows when I get a new device, and if you guys have ever seen Devil Wears Prada, when she makes that pursed lip like that, it's usually not a good thing. In my practice, when I make that pursed lip, everyone smiles because they know I'm gonna love that technology. When I first got what we call BBL in Motion, or now Hero Forever Body, I made the pursed lip. And I was so happy because I couldn't believe the rapid pace that we could treat the area. The response when you're looking at the skin, you see that pigment darkening immediately with sun damage. You see the confluent erythema, which is very important because that tells you that you did a very good treatment without risk of burn. And you see the full area coverage. And I made that pursed lip because I was so happy that I was going to be able to do this treatment fast, effectively, and with minimal downtime. The thing is, my patients want to see me, and they actually pay a lot more to do it. So now if I can treat a large area more quickly, I can do a lot more, making my revenue a little bit higher, but also really being able to spend more time with my patients doing other things. And there's just a high patient satisfaction. 1 or 2 treatments, huge amount of clearance. More treatments, you're going to get improvement in wrinkles and some tightening, which is amazing. So this is how this is forever going to change how you treat pigment. It's not as labor intensive, much more ROI. And like, for example, if you're the one doing the treatment, some practices have it where the doctors are doing it. You want results. You want to not spend as much time. In the old days, all we did was stamp, stamp, stamp. 1 hertz. It took so much time, but there was a high amount of energy being placed at that time, 12, 14, 16 millijoules. Now we're talking about in the range of 6 to 8 millijoules, but at rapid hertz, fast pace for a let's say a 10 square meter area, a square centimeter area. So the rate of side effects is much less. The treatments are so fast, the outcomes are improved, patients feel comfortable. You really don't need to numb for this. I typically don't like to numb at all, actually, for at least for a Forever Young on the face, because I don't want the blood vessels to change if I'm going to treat them. Let me show you again, old school, static 1 hertz. Look how long, even with the larger spot size that the BBL device has, it's just, 1 or 2 hertz, just taking so much time. Take a look on the bottom here with our rapid body. Look at the pulsing. I mean, this is like, 1, it just looks cool, and 2, it's just damn exciting. This is M-Joule. If you look down here, millijoule or mini-joule or microjoule, whatever you want to call it, it's an amazing new device that has on it the BBL Hero. You could see here he's doing a 4 hertz, 2.5. Let me see, it's 25 degrees, 4 or 5 degrees. I can't tell what joules that is, but it's very small amount of joules at a very fast rate. And so you can basically treat anywhere, legs, arms, back, very, very quickly. I love it. And again, let me show you this. Let's show you this on the chest. So in general, it could take you 15, 20 minutes, maybe to truly treat the chest properly. In the old school IPL or BBL, 1 hertz was stamping. Here we're using in motion BBL Hero, high energy rapid output, super quick, couple passes overlapping. Look at the confluent erythema, you guys. That's the key. And also in those that have a lot of sun damage, you could see immediate pigment darkening. And so your technology is just advanced. I mean, this is the iPhone 11. Like I said, in 1.5 minutes, you've treated an area that would have taken you 10 minutes to 15. It's 10 times faster. And look at this after just a treatment. It's pretty damn amazing. Now, in my practice, I still would have probably combined a non-ablative laser, some PRP, and obviously skincare. I actually would have had this patient had a pre-treatment peel before they even came in, because I believe in lifting the pigment, but a lot of this is poikiloderma or redness. This is a phenomenal outcome, even a few months after. So in general, I tell people the first treatment or two do about 4 to 8 weeks apart, and then afterwards every quarter to maintain. This is an actually amazing result with no stamping and with no striping or stripping of pigment. Same thing here. Again, you know, more difficult case, the person obviously even with treatment is still in the sun. You could see the sun line, tan lines there, but even while in the sun, which you shouldn't really do these treatments, but if you do, obviously having sun protection and skincare, you could see improvement there much more quickly. And again, in somebody with significant sun damage, you could see these, you know, striped wrinkles. That's where I would combine the Moxie. You could see down here 6 at 4 hertz. Delivering a high amount of energy actually in a small area. However, no risk. And in this type of skin, you typically would see a lot of striping and hypopigmentation that would require a 1927 wavelength to even it out, but overlapping passes of an IPL or a BBL to really even out the pigment. Here you don't have to worry about it because there is no striping, there is no irritation on the skin, even after treatment. And some of these, you guys, are not just sun damage, they're DPNs or dermatosis papulosa nigra or macular suberokeratosis. They still improve. I typically would independently treat these larger spots with either a Q-switch laser or desiccation. I would then combine it with the BBL device, and then I would add my Moxie or my Halo. For just a single BBL treatment, this is quite phenomenal. With proper skincare, hydroquinone, retinol, growth factors, you can get a really amazing outcome. And what I would have done is a couple weeks after the treatment, I would have then added a peel, like a lightening or an exfoliation type of peel. I actually created in my new skincare line, Emerage Skin, that we have at emeragecosmetics.com, a non-hydroquinone lightening mask that can be put on large areas a week after doing this treatment. I made it specifically for doing Forever Young and Halo because it enhances the outcome. And those types of peels and masks, I think, are going to become much more popular in the day and age where we are right now, post-COVID, where people don't really want to be going into the doctor as much. And what's great is, so when they do, you want to give them a big result, which is what our BBL Halo can do. Our BBL Hero can do, combining that with Halo or Moxie or peels really will make a lot more of a result that they're going to see and want to do those bigger quarterly treatments. So that mask is called Aerify. We have it at emeragecosmetics.com. And I'm just super excited about, utilizing this with our newer technologies that we have here. I've never seen anything like this before. The degree of pigmentation improvement you could see here on the arm, but look at the lower part of the elbow, wrinkle improvement. And that's because of the fast pulsing builds up dermal heating. And that's what SkinTyte does. We're not talking about SkinTyte today, but It's a fast pulsing, deep delivery of light energy. Here we're getting that same thing using Hero. So Forever Body BBL on here using fast pulsing and less energy, so there's no striping and no stripping, but you're also getting tightening. Same thing here in a hand, where it's much more difficult, much easier to burn the skin. You can see fluence of 7, rate of 4. You know, typically you're doing somewhere 14, 12, 16. An area here may be a little bit less, 10 to 12. Here we're doing a fluence of 7, but delivering a high amount of energy. So you're getting that tightening as well, which is pretty amazing. And even, you know, here's again 1 or 2 treatments. Had we combined this with Halo, had you combined this with Moxie, had we done a Aerify peel or a lightening mask on the back, or even a TCA, you know, prior to or after, you know, these combinations are really what people want. They're what they want to do. They want to follow skincare afterwards. They want to do at-home treatments, and that makes them want to continue their regular treatments with you in the practice. And you could see these types of improvements. And so again, now 3rd treatment, again, significant improvement. Let's boost that result. Let's add in the Moxie. Let's add in the Halo. Let's do a mask at home like Aerify that I made, you know, which is basically retinol based with botanicals for lightening of the skin. That type of thing is what our patients want. And in the past, we couldn't do this, you know, much more difficult. And the non-ablative lasers that we had before had much more downtime. Now the ones we have much less pain. The downtime is minimal. You can use skincare right away. The results are phenomenal. And you see up close, let's take a look at the before, you take a look at the after. I'm going to flip back and forth so that you could see the pigment is lightening. And so again, when someone has significant sun damage like this, it's combination treatment that's needed. You need to do Forever Body. You need to use Hero to get rid of the poikiloderma and the pigment, but you need to do mask peels and other creams combined with, so you get enhanced outcomes. And that's what's exciting. You know, if you go on M-Joule, you're going to have your Moxie. If you go with Joule X, you're going to get your Halo, ProFractional, Contour, etc. So there's significant improvement here in not only pigment, but also tightening of the skin, redness, and we can enhance that with more treatments. Spot count is decreased, you see here, significant amount. So that's the end of my presentation. It's just an overall excitement about BBL, probably my favorite technology. And you guys know I have over 82 devices. I work with 16 different companies. I am not the person to be committal, but I love Sciton. And I think that there's so much in this day and age where technologies, that's what people want, advanced technologies, and they want quick results with limited downtime. Forever Body and BBL Halo is going to be your go-to treatment in your practice. And then the long-term plan is going to be combining non-ablative resurfacing with BBL so you get enhanced outcomes. Thanks, guys.